I'm Dr. Girish Soni, practicing neurologist in Lilavati Hospital, Bandra, Mumbai. Today we are going to discuss about GBS or AIDP. GBS is a nerve disorder where patient develops weakness in all four limbs. For better understanding, let's divide it into three parts: mild GBS, moderate GBS, severe GBS. Mild GBS we can manage on OPD basis also, or we can admit the patient for observation in the hospital for few days, because the weakness can progress for a duration of 5, 7, 10 days duration. For moderate and severe GBS, hospitalization is needed. Moderate GBS we can admit in ward. We should start IVIG, which is an intravenous immunoglobulin, or plasma exchange, which is a sort of dialysis form of treatment which works as an immunomodulator in GBS patient, and they gives benefit in the form of recovery from the weakness, prevention of the person going to the ventilatory support, or if the person is on ventilatory support, it helps the person to come out of that ventilatory support earlier. So IVIG and plasma exchange, they act as a immunomodulating agent in such cases. Basically, in GBS, the natural course of the recovery of the weakness is over a period of weeks, at times over a period of months, depending on the severity of the nerve affection. So in such situation, once the hospitalization period is over, once the ICU period is over, the most important form of treatment that remains is physiotherapy, mobilization, and a good nursing care. Prevention of infection always remains a top priority, even in hospital, even at home. The infections can happen like urinary tract infection, bed sores if the person is prolonged bedridden, or lung infection. GBS itself can cause weakness of the throat muscles and causing the aspiration pneumonia. So our topmost priority whenever someone with GBS is admitted is prevention of complications also, apart from managing the GBS illness. So most of the patient, almost 95% of patient, they recover from this GBS almost completely. Duration varies on the degree of severity of the GBS. Most of the people, they definitely improve over a period of weeks to months. Some people may take years to recover. Please remember that thing. So with GBS, never lose a hope. So once person with GBS is discharged at home, what things need to be done? Most important is physiotherapy, and that too relatively aggressive physiotherapy. To nutritional support to the person, to help to build up the muscle bulk, muscle mass, as well as for better nerve and muscle recovery. Third, prevention of complications. We always need to take care of prevention of urinary tract infection, bed sore, and aspiration pneumonia. Urinary tract infection prevention is good care of the catheter by a medical staff. Bed sore prevention is frequent bed position changing. Don't keep the person lying down in that position for a long time. Always every 1 to 2 hourly change their position. Throat infection prevention, always keep the person at a degree of 15 to 30 or 45 degree angle from the bed. Always feed the patient in sitting position. After feeding, don't allow person to sleep immediately within 30 minutes. After taking food, keep the person in upright for at least 30 to 40 minutes. So over a period of few weeks to few months with physiotherapy and good nursing care, definitely all patients, they improve. When to report doctor once you are discharged to home? If the weakness is going down again after improving, that could be GBS fluctuating related weakness. Sometimes it can be a relapse of GBS. The person recover over a period of 2 weeks, 3 weeks, 4 weeks, and again they can go down. So if you see any change in the pattern of weakness or weakness going down, please report to the doctor immediately. If person develops fever along with some turbid color of the urine, along with increased cough, you are able to hear some noise coming from the chest, please report to your doctor immediately. Or you are able to see some infected wound over the back area or back of the thigh, back of the leg area, that is bed sore. And if you are seeing such things, please report to your doctor immediately. So friends, GBS is treatable and curable illness. The patience is very important. Medications like IVIG, plasma exchange are needed at appropriate stage. Post that, physiotherapy, good nursing care is needed. Thank you.